Hello friends, welcome to the new session of Hospital and Clinical Pharmacy. Myself, Malvi Rajendra Bhavsar, KK Bagh Institute of Pharmacy, Nasik. So, today we'll deal with the new chapter, Pharmacy and Therapeutic Committee. So, learning outcomes. After watching this video, student will be able to learn meaning of Pharmaceutical and Therapeutic Committee, functions of Pharmaceutical and Therapeutic Committee, and role of PTC. So, first we'll deal with introduction. A large number of drugs are available for the treatment of disease. The use of many drugs is complex, so rational therapy is therefore the need of hour. The hospital as an organization responds to the rational use of drug by erecting a committee called Pharmacy and Therapeutic Committees, which formulate policy regarding therapeutic drugs. The PTC members are chosen from all sectors of healthcare, which includes the pharmacist, administrator, nursing staff, medical staff, etc. The committee plays dual role of being an educational as well as advisory body. The composition of committee varies from the hospital to hospital. The committee is appointed by the governing board, elected official of the medical staff. The administrator may act as its ex officio chairman and the pharmacist as its secretary. Then functions of PTC. First function is the committee develops, compiles, and rectifies the hospital formulary system sponsored by the medical staff. The medical staff adapts the formulary according to the need of individual hospital. Second function, the committee promotes rational therapeutic treatment and prevent duplication, waste, and confusion. Third function, the committee develops written policies and procedure to afford the guidance, appraisal, selection, procurement, storage, distribution, and use of drug. It also develops policy regarding drug safety. The committee's recommendations are adopted by the medical staff. Then the formulary is subjected to constant review and revision. Seventh function is the committee minimizes the duplication of same basic drug, drug entity, or drug product. Then eighth function is the committee helps the development of training program for professional staff in drug use. The PTC studies problems related to drug administration, distribution, drug reaction, drug stocking, and drug use. 10th function is the PTC advises the pharmacy regarding drug distribution and control procedure. The role of PTC in drug safety. What is the role of drug PTC, Pharmaceutical Therapeutic Committee, in drug safety? Drug safety happens to be a major area of responsibility of the hospital pharmacist. So, most of the times the safety aspects are taken for granted since accident due to the drug occurs so infrequently. However, once the accident is reported, the working of the pharmacy comes into focus. And it leads to crisis management, then steps are taken accordingly. The PTC can help an effective role in ensuring drug safety on the continuous basis. Then PTC and subcommittees. Okay. So for its effective functioning, the Pharmacy and Therapeutic Committee may form a several subcommittees to formulate policies regarding the rational therapy for the following group of pharmacological agent. Here, the rational therapy indicates right dose, right regimen, right frequency at the right time with the correct route of administration, which is nothing but rational therapy. So, for these rational therapy, following groups of pharmacological agents are there: cardiovascular, CNS agents, anti-infective and antibiotics, gastro-intestinal agent, endocrinology, and neoplastic agent. Then PTC and drug safety. Okay. So pharmacy and therapeutic committee as well as drug safety. So how they are related? How PTC can identify that drug is safe for the patient or not? Not. So for this, pharmacy and therapeutic committee requires to ask various questions which are as follow. So are pharmacists first question is, are pharmacist and his assistant adequately qualified? Second, is there a practice of dispensing by non-pharmacists? Third, is the manpower of hospital pharmacy adequate to do justice to the workload? Fourth, is the hospital pharmacy spacious enough? Has its storage facility? Is it properly equipped? Fifth, is there regulation of dangerous drug? Sixth question, what is the policy of dispensing in off hours? Seventh, how are the poisons and non-poisons separated? So, how are the external and internal use preparations separated? Then, eighth question comes in mind is manufacturing carried out in the hospital? If yes, then does it allow the good manufacturing practices? Ninth question which arrives in mind is there a training program actively engaging the service of pharmacist to teach other professionals the use of drug? Then, is there a physical variation of drug for expired or outdated or deteriorated products? Is there a documentation center and library? So, commencing different types of questions like this, we can relate the role of PTC in the drug safety as well as efficacy. So, PTC and adverse drug reactions. Okay, now drug therapy is becoming complex, so there is increasing incidence of adverse reaction. So, the problem is to tackle at two levels: how to prevent the adverse drug reaction, and second, once they occur, then how to treat them. So, what does PTC do? It will develop the reporting system for this purpose. Then, the adverse drug reaction reports names of drug, routes of administration, the date of starting and ending the treatment, the indication for which drug were used, the adverse drug reaction noted from them, and the step taken to treat this. So, the ward or nursing station passes this report to the chairman or of the PTC. Then, in recommended procedure, physician himself produces a place the adverse drug reaction report before the chairman of PTC, and the same is then ultimately placed with the medical record room. The PTC and emergency drugs. Certain emergency drug must be placed handily by a bedside. The PTC has to make the list of such drug and supplies to prepare an emergency box or a kit. The same are then placed in the ward. The emergency box contains different syringes, needles, cutter, tourniquets, drug like aminophylline, amylnitrite, atropine sulphate, calcium gluconate, digoxin, amphetamine, corticosteroid, mannitol, nalorphine, neostigmine, phenobarbital, phenylephrine, procainamide, saline or injection, ringer's lactate injection, water for injection, and other emergency equipment. Then, lastly, we see is conclusion. What does this topic conclude? It concludes that PTC, that is Pharmacy and Therapeutic Committee, is a backbone of hospital pharmacy and renders the great service to make the hospital productive. Thank you, dear friends, for the great listening. Thank you.